What's the reason to talk about Medicare and Medicaid when we spend a lot of time on individual markets, and which is we've talked about, which is actually a much smaller piece of the pie, even though a very critical one that's not been working very well for many years, is because what we do in Medicare and Medicaid can really affect what happens in healthcare. We're going to double the number of seniors in our country within the next couple decades, and we're really talking about 40 million people on Medicare right now. We're going to go to 88 million people on Medicare. So it is a huge opportunity and challenge to how we can provide better care and a great opportunity for us to do it in the right ways. We need to be smarter about the financing the way we actually pay for health care that drives a change in delivery of care. And really changes the nature of this argument that often happens between insurers and providers, and changes the culture within providers. And that's a capitated system that allows you to have early intervention, to manage people's care, to have specialists talk to each other, to have systems talk to each other. And a lot of this is happening today under Medicare. It's called Medicare Advantage. And I'm going to say it's perfect, but it certainly is moving in this direction to really say we're going to now not just pay the insurers, but pay providers to take some of the risk and change the way they provide care. A third of people on Medicare have chosen Medicare Advantage. And what they like about it is it turns out they like care management. We used to think it's annoying. It turns out that some people find it annoying, but many people say I could never have managed through all of the health care that I needed without some help. We know increasingly what works. The idea is how do you get more and more providers to do it? And you do it by paying them to do it and create the incentives to do it. And it's being done better in some parts of the country. It's being done better by some primary care groups than others. And we should build on the evidence of what's working. One of the things we work on at the organization I work on now is just what are the best practices? How do we share those best practices, and how do we get it done? But it's not going to happen if we continue to pay doctors fee for service for interventions, and that's what we have to change.